This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
All right, very good. Again, my name is Mian. I'm a PGY4. Thank you all for staying a little bit longer. Apologize for the miscommunication and mix-up. However, we're ready and we're excited to talk about UCLA Health and the Greater LA VA's PM&R residency program. We seem to fall in the final presentation of the California, so you all know we're based down sunny Los Angeles, California. We'll talk a little bit about who we are, details about our rotations, some skills that we perform by graduation and hone in on before we go into the workplace or fellowship. What's life like after graduation, who goes into fellowship and who goes into the workforce, where we live, some benefits, and some pictures of how fun we are. So first things first, just a little bit about who we are. We are a diverse program with varying backgrounds and interests, but we do have a very serious work hard, play hard lifestyle. Although we come from a lot of different backgrounds and a lot of different hobbies, Dr. Aragaki and the admissions team takes a lot of pride in finding people that are either introverts or extroverts to come together and all be team players. So we have currently residents that are semi-professional or professional athletes. One of them's ultimate Frisbee athlete that competes nationally, to some professional DJs, to photography enthusiasts and food and coffee enthusiasts, and anything and everything in between. We have single, engaged, married, and recently a couple parents as well. One of the biggest things that we find among the culture of our program, as well as the just the overall sense of community in our program, is that we have a lot of friendly, approachable, and compassionate faculty who take a humanistic approach to the care of their patients. On the left here, you'll find Dr. Fish. The leftmost is Dr. Fish, and then followed by Dr. Vu to the right of him, and then Dr. Chen. Dr. Fish, Dr. Chen are UCLA spine interventionalists. They work within our pain fellowship that's associated with the UCLA VA, but as well as teach residents in one of our POP rotations. We'll go over that in a little bit. Dr. Vu is our is one of our program administrators and one of our assistant program directors. And then all the way over to the right in this picture on the left is going to be Dr. Epin. Dr. Epin is actually the PM&R chair of the VA. All the way over to the right over here, just to go down the line again, Dr. Vu. Dr. Saber, to the second most to the left, she's one of our West LA VA ARU attendings. And then to the right of her, Dr. Swami Nathan is one of our Cal Rehab attendings. And then the infamous Dr. Aragaki, our wonderful program director, who we all love and cherish. So we'll go over a little bit of our rotations. We have general, we do have injection-based clinics. They're dedicated to injections only, whether they're joint, bursa, or trigger point muscle, anything in between. We have electrodiagnostic rotations that are coupled into or dedicated within our outpatient curriculum. We specifically go to TBI rotations, spinal cord injury, and peds. We'll start with the West LA VA. At the West LA VA, the first rotation we'll talk about is the ARU. We have exposure to stroke, amputee, and postoperative orthopedic and neurosurgical care. The attendings that we mentioned are Dr. Vu and Dr. Saber. They are both two of the most approachable attendings you'll ever work with. Can hold your hand for as long as you need or allow you to have autonomy once trusted. We also have a continuity clinic that's a part of this ARU rotation, which allows our veterans who do get discharged to make sure that they are at least safe and have follow-ups, particularly for our post-amputee care patients. The VA ARU and actually all of our acute rehabilitation unit rotations are either home call or if you're at another outside standalone rehabilitation unit, we'll talk about long call, but we have no overnight call or in-house call, should I say. It's all home call. This specific one at the VA ARU is going to be 1 week at a time. And when you have 6-week blocks, you'll end up having 2 weeks out of that for call out of the 6-week block. In total, you'll do two 6-week blocks of the VA ARU. And having those home calls are actually, as was mentioned in the Stanford presentation, very, very nice and obviously much nicer to be able to sleep in your own bed. And within the VA ARU, we have once or twice weekly interdisciplinary rounds, as well as team conferences and they're all solely led by the residents, so that you are learning how to be able to do this in the real world if that's something that you wish to pursue as a career. Our West LA VA clinic, outpatient clinic, is a variety of clinics packed in 1 week. You'll have electrodiagnostic full days or half days. There's general PM&RS, so general neuromusculoskeletal medicine. And we have a very comprehensive chronic pain and interdisciplinary headache clinic that is one of the highlights of our program here in UCLA West GLA, where we have not only physiatrists, but we work with psychiatrists, we work with substance use disorder specialists, we also work with clinical psychologists, and we work closely with the comprehensive pain rehabilitation program, so we can give our patients multimodal and multidisciplinary chronic pain control. And then for one of our final clinics is the neurolysis/spasticity clinic, in which we get exposure to spasticity management with botulinum toxin. One of the biggest highlights of our program is that we do not only meet, but exceedingly go beyond the requirements for procedures. We haven't had any residents miss out on any kind of EMG or nerve conduction study requirements for ACGME, and a bulk of our soft tissue bursa and joint injections are happening frequently and within that PGY2 right off the bat. Another one of our consults here at West LA VA, rotations, is going to be consults as well as the cardiopulmonary rotation. Consults are going to be separate and distinct from the West LA ARU rotation, but however go hand in hand in the fact that there's constant communication between both residents and both groups. Cardiopulmonary consults happen in the cardiac ICU, and then there's a pretty robust education program that goes in, not only for patient education, but teaching as a part of the residents' requirements, as well as a post-COVID clinic as well. The Sepulveda VA is one of our outpatient VA-based rotations. It is not a hospital-centered rotation. However, this is just a purely outpatient. We get more EMG exposure there. There's also a dedicated injection clinic there where we work with ultrasound as well as anatomic-based injections. It is the general MSK clinic is what we would typically think of for a PM&R clinic. And we also do get a half day, one resident every Tuesday will be able to get rheumatology clinic exposure in the same facility over there to gain a little bit more of an idea of how rheumatologists might see some conditions that may overlap. Within the UCLA Health Network, we work heavily with interventional spine specialists, UCLA Santa Monica and the UCLA Spine Center. And then with UCLA Ronald Reagan, we're approaching a very good relationship to hopefully be able to work not only consults in there, but inpatient pain consults, the wheelchair clinics on an outpatient perspective, neurology clinics and amputee clinics there. Because of our relationship with UCLA Spine and UCLA Santa Monica, we're able to get a good volume of neuroaxial procedures and a good exposure to a lot of the potential pain faculty if you were to want to stay local for pain fellowship, as well as the non-ACGME accredited interventional spine programs around there. California Rehab Institute is one of our longer rotations as well. You have 3 6-week blocks there. California Rehab is the largest standalone rehab unit in the West Coast. It's a 138-bed unit with a wide variety of etiologies presenting from not only Cedars, but UCLA, St. John's, and larger hospital networks around the area. One of the things that we want to talk about here is that they do have a call schedule as well, but the call is mostly like a long call and something that you might see in your intern year program, so 7 a.m. to 7 p.m., where you do have an in-house pager there, so you do have to stay in there, and that'll be from Monday through Sunday. That occurs roughly twice per 6-week block, so a total of 6 weeks during the entirety of your rotation experience at Cal Rehab. Some of the perks there, obviously the attendings are wonderful. A lot of them generally tend to be younger, very passionate, and teaching-oriented attendings, despite the fact that this is a private institution and is non-resident required or non-resident run. However, they take the time to be able to really teach us, really allow us to have autonomy, and allow you to feel like you're really leading that patient's care, with the understanding that they will have to get their stuff done no matter what. And then there's one of the last things you'll see, and this is kind of gets pretty fun. There is a VIP population, given the fact that we are in the heart of LA. But once you're able to see that, you realize that all patients should be treated exactly alike, and it becomes humbling to see what can and will happen, and how we can help them most. Rancho Los Amigos is our hub for TBI. This is one of our most exciting and favorite rotations amongst the residents. This is where you'll get the best exposure to spasticity management with botulinum toxin injections. And it is the world famous rehab center, not only back in the day for polio syndrome, however, with the Rancho TBI scale that was originated here, and the mother and master of GATE herself, Dr. Geffen Perry. All of the doctors that you work with there are TBI trained. They're hands-on. They're incredibly detail-oriented and I'm looking for the word, but they're incredibly evidence-based oriented, should I say, and are really up to date with their knowledge on TBI medicine. The rehab facility is brand new as well, the outpatient facility there, and serving the county population allows us for different diversity or different exposure in training. Not only do we get that VA, but we get that private that we talked about, and now the county population, allowing us to really be well-rounded physicians and understand the healthcare networks once we do graduate. Children's Hospital of Los Angeles is a top 10 pediatric hospital in the country. We get comprehensive pediatric rehabilitation experiences, not only in TBI, SCI, but other ortho rehab in very rare cases. The attending that we do work with there is one of the leaders in pediatric rehabilitation internationally, and does serve as guest speaking, does do guest speeches and whatnot in the pediatric rehab community. The Long Beach VA is our hub for spinal cord injury. We do have as one of the cons to this, it's important to be transparent. It is quite the drive when you do live in Los Angeles. However, the ability to be able to give a spinal cord injury patient very robust care through a VA system that does offer a lot more than a private system can, allows us to really hone in on that medicine and really be able to learn a majority of what needs to be done for these kinds of patients. Within this rotation as well, it's split into an outpatient and inpatient. So it's a 3-month block, so 6 weeks outpatient, 6 weeks inpatient. And during that outpatient experience, and sometimes even during the inpatient, you'll get to do a wheelchair day and adaptive sports and learn a lot more about these sports equipments that a lot of our veteran population may be eligible for after they experience a spinal cord injury. So kind of speaking of that, you'll see over to the left, wheelchair day. That's myself over there. We have to, it's part of the rotation requirement, we have to spend an entire day in a wheelchair so that we can truly understand what it may be like, even for our non-impaired population, to be able to drive a wheelchair all the time. I'll tell you firsthand, it's incredibly tough having to go in there. So it definitely is a humbling experience. One of the unique experiences that we get at Long Beach is to be able to first assist in tendon transfers. Dr. Wendy Ng is the orthopedic hand surgeon there. And when all conservative and minimally invasive procedures for spasticity management don't work out and patients are eligible for tendon transfer based on the type of contractures they may have and available tendons they may have there. It's a very robust process. We are able to have the pleasure of working with Dr. Wen-Ying in order to be first assist on those procedures. And the adaptive sports world in Los Angeles is super in tune, and we have the pleasure of being able to be help out and learn more about that aspect of medicine throughout many various experiences, not only volunteering, but within our rotations as well. Angel City Sports, these are some of the other ones that we can do. Angel City Sports is one of the volunteer opportunities that we have that we've been working with over the last at least 4 to 5 years for our disabled population. It's a truly incredible experience. Hand cycling, and you'll see over here on the right, wheelchair basketball. All of these we are able to volunteer as healthcare professionals that go there, but we learn a lot in that process as opposed to the other way around. This is just going to go over some call schedule. Again, like we talked about, there is no overnight in-house call. There is going to be overnight home call for the VA ARU. When you are in VA consults as well as the cardiopulm rotation, you do share call with the acute rehabilitation unit. However, within those 6-week blocks, you'll only get 1 week of call if you're on consults and cardiopulm. If you're on ARU rotation as it is, you're going to get 2 weeks every 6 weeks. So that's why you'll see 3 months, you have 4 weeks of call, and when you're on consults or cardiopulm, 3 months, 2 weeks of call. At CHLA, the 2 months that you spend there, you work with the attending there to figure out what 4 total weekend days you come in and round on the patients and drop some notes in, make sure everything's going okay. But there is no overnight or extended hour calls there. And California Rehab, we talked about for the 4.5 months that you're there, you're going to experience 6 week total call, and that's going to be the long call, kind of 7 a.m. to 7 p.m. in-house. Most rotations are 8 a.m. to 4:30 p.m. unless on call that we talked about above, and about 14 weekends over the 3 years, which is really not bad. And it can be spread out kind of anywhere between PGY2 to PGY4 year, depending on how your schedule was created. So one of the biggest things we were able to do here as well is figure out kind of what we're most confident in after leaving our program. We've had these questions a lot. We've polled a lot of our alumni on this, and patients or residents that do graduate and go on to work in ARU level feel very good about treating all kinds of conditions and all kinds of healthcare systems and adapting well to those. We have those robust SCI and TBI populations as well as part of our training. So even managing those have been a very confident measure within our program as well. Ultrasound guided injections, as well as anatomic guided injections talked about. Electrodiagnostics, you jump in and dive in right off the bat in PGY2, even maybe the first day you come in and get oriented. And you have a plethora of experience throughout your first, second, and third years as a PM&R residence. And then again, we talked about the various settings. So academic, private, county, and VA, and really there's nothing much more in between that you can get exposed to. So having the ability to learn about those healthcare systems and be able to go out in the community and do that once you graduate, it makes that learning curve a lot easier. And because of the fact that we go to so many different sites, the EMR is, we work with CPRS, we work with Epic and Cerner. I think CPRS will be transitioning to Cerner soon. So we have a good amount of experience to kind of avoid that learning curve when you go out into the real world.
All right, and you have 2 minutes remaining.
Perfect. So what do we do after residency? So the last 3 years, we've had pain fellows, we've had sports medicine fellows. We recently had one go into spinal cord injury and traumatic brain injury this past year. We have a lot of our residents apply for and go into the non-HTMA accredited interventional spine fellowships. So whether that's through NASS or if it's through other ones, such as in USC or UCLA. And then we have probably maybe I would say 30 to 40, let's say 30% of our residents graduate and go on to the workforce. So whether that's acute ARU, or subacute consulting, SNF work, or even general MSK. Through the Kaiser systems, very popular kind of funnel, but we have a very wide range of work opportunities and fellowship opportunities through our residency program. Given that we do host the Pain Medicine Fellowship, one of the few ones in California, the UCLA Pain ACGM accredited one, as well as our close relationship with West Coast Sports Foundation, we do have a good sports and spine as well as pain fellowship outcomes. Now, our programs rotate closely with the PDs of the UCI and Long Beach VA spinal cord injury program. So that's also somewhere that can be popular for residents to go into as well. And we talked about our alumni that actually created the non-ACGM accredited interventional spine program. Our alumni are very, very well intertwined with our program. A lot of the times they can be hired as our general MSK or even pain attendings, but we have a lot of them coming back as guest speakers. We see them back in a PM&R, and given that camaraderie that you experienced during the residency itself, it's very oftentimes we'll see them come back and kind of give back to the community and hand that forward. Speaking of our
that's time, but
Sure.
we will let you guys wrap up this slide and also
Sure.
answer a few questions as well, because I see there are a couple coming into the chat.
Perfect. This is probably a perfect segue. Dr. Aragaki is a lot of the reason why I chose this program. Mama Gaki is what we call her. A lot of our fellowship, of all of our fellowship attendees, whether they're residents going in, all have talked about how they've been told to say hi to Dr. Aragaki. She's got very high leadership positions in the AAP, as well as really well respected within our local community and nationwide PM&R. We talked a little about downsides, but we'll kind of go in on that, and I'll save some time for questions.